Carving pumpkins this weekend ahead of Halloween, but be mindful, the slip of a knife could leave you with a pretty serious injury. Joining us live this morning to explain what to avoid is Dr. Hudson Seidel. He's an orthopedic surgeon with the Connecticut Orthopedic Institute at Mid-State Medical Center. Thanks for your time this morning.
Thank you for having me.
Of course. So this is timely. A lot of people are going to be carving the pumpkins with kids, with the entire family. How common are pumpkin carving injuries?
Well, that's an excellent question. You know, we see about 4,000 on average Halloween-related injuries every year, and it's estimated about half of those are related to pumpkin carving, and a lot of times from people ending up stabbing the front of their hand. These can really lead to pretty significant injuries because we have a lot of really important structures there. We have our flexor tendons that help us bend our fingers down, and our arteries and our nerves to our fingertips are there, so you can actually end up injuring those. So we want to take proper precautions to make sure we don't have those kind of injuries this season.
So I guess, do you have advice when it comes to the do's and don'ts when it comes to pumpkin carving?
Yes, there's a lot of ways, we can try to prevent these injuries as best as we can. My first recommendation is that you use a proper pumpkin carving kit. You know, the natural inclination is to just pick the sharpest knife in your kitchen, but that's really not a great idea. Those knives are extremely sharp and can cause a lot of injuries if they do end up slipping. The second is you want to use proper techniques, so you always want to stabilize the pumpkin with your non-dominant hand, and then make sure that you're cutting in a downward motion. You're less likely to injure yourself that way than compared to coming up and the knife slips that way.
Yeah, that makes sense. I guess sometimes we've all done this. When we get injured, we take a look at it and say, oh, we don't need to go to the hospital. We don't need to go get this checked out. When should someone take that injury seriously? What should they be doing?
Yeah, so the first thing you should do if the knife does slip and end up, cutting your hand is you want to apply direct pressure on it for a period of 10 to 15 minutes, and that should hopefully stop any bleeding that's present. If there is still having some bleeding present, you certainly want to go get that checked out at the ER because you could have injured those arteries I alluded to earlier. And then you want to make sure that you clean that area thoroughly with water and make sure that there's not any residual debris there as well.
And this is obviously when your expertise comes in handy, surgery. Do you see a lot of surgeries after pumpkin carving injuries?
We do. We see a lot of injuries to those flexor tendons, which require a lengthy repair. Things to look out, as you mentioned earlier, for afterwards is you want to notice if you have any numbness or tingling on any of the fingertips. That could indicate you maybe hit your nerve or injured your nerve, or any difficulty bending the finger down or making a fist. Those are things that you really want to look out for. But even if it's something that doesn't necessarily need surgery, we know that people that come in earlier have better outcomes long term. So I always recommend coming in and seeing us, even if it's being managed non-operatively. Our hand therapist can really help with any swelling or inflammation that's present as well, and getting that under control.
Wonderful. Dr. Hudson Seidel, great advice this morning. We appreciate your time. You said Halloween is busy, so thanks for joining us.
Thank you for having me.
All right, we will be right back. Keep it here.